Hi, my name is Kathleen Lisson. I'm a certified lymphedema therapist practicing in San Diego, California. We're at my studio in Pacific Beach right now, and I am super happy to talk to you today, my friends at Breast Friends, about cancer treatment's dirty little secret. So, cancer treatment's dirty little secret, one of the side effects of cancer treatment that's not well talked about and well understood by so many people who have a cancer diagnosis, especially a breast cancer diagnosis, is a condition called lymphedema. So, this is a chronic condition that will last for the rest of our lives. They are doing some research. They're trying to study to find a cure, but as of today, there is no cure. There are several ways to handle it and several treatments, but right now there is no cure. So what lymphedema is it's a swelling. So if you had a breast cancer diagnosis and you had treatment for breast cancer, say it was on the right side, the area that you would look for this lymphedema swelling would be anywhere in the arm or anywhere in the torso, down to the end of the rib cage, and also the back as well. So all these are at risk for lymphedema. So what happens is during the cancer treatment, if lymph nodes are affected, then the lymphatic system's ability to move the lymph fluid in that quadrant is affected. So some of the things that can be affected are if the lymph nodes there's a sentinel node biopsy, any of the lymph nodes are removed during the surgery, and also if you have radiation in the area, if any of the lymph nodes are radiated, that would also put you at increased risk for lymphedema, and that risk continues to the end of our lives. Some people do get lymphedema symptoms months after their surgery, and some people get them decades after their surgery. So it's something we just need to know about and be aware of for the rest of our lives. So we covered how you would develop lymphedema. Let me tell you about some of the symptoms so you know what to look for. And this can be in people who have a breast cancer diagnosis. Also, lymphedema can occur in other cancers, basically anytime that we affect the lymph nodes. So head and neck cancer can get lymphedema in the head. If you have a gynecological cancer or melanoma, you can get a lymphedema in the legs. So what we're looking for, if it was in the arm, since we're talking about breast cancer diagnosis and treatment now, it would be anything. The swelling could begin in the hand, so we would see maybe instead of seeing all the veins in the hand, it would become more youthful. It would look a little bit smoother. The rings can start to not fit. Bracelets can get tighter. If you have clothes and then you just notice that like this arm is tighter than this arm, and it used to be the arms were fitting equally, but maybe one of the sleeves becomes tighter on your clothes. Anything to change with the bra size, or one breast can become larger than the other, that's also something to look for. If someone sees you from behind, say you have a tank top or a backless dress on, the torso, one side of the torso can look larger than the other side in some types of lymphedema. And then the subjective symptoms, like does it feel heavy? Does it feel, there may be some just feelings of heaviness, and then at first it may come and then go away. So the first signs of lymphedema can be like swelling, but then if you put your arm up, then the swelling goes away. But eventually it does progress into a swelling that doesn't go away. So if you have any of these symptoms, the important thing to do is to go to your oncologist or your primary physician and just let that person know and ask for a referral to a certified lymphedema therapist, or if they have a lymphedema clinic. And a certified lymphedema therapist can be a physical therapist or occupational therapist or a massage therapist that has this extra training in treating lymphedema. They can give you information and some tools for you to use, and then they can also put you through a treatment which is called complex decongestive therapy, and that would involve wrapping the limb and issuing you or writing a prescription for a compression garment, and that will keep that swelling under control. But we're kind of getting ahead of ourselves here, because I want to keep you safe for the rest of your life and hopefully not develop lymphedema. So some ways that you can kind of lower your risk is to take care of your skin. A lot of them involve taking care of the skin. So that would mean preventing sunburn by wearing SPF, wearing bug spray if you're going to be out and you think you're going to be bitten by a mosquito, wearing gardening gloves if you're going to go into the garden, being aware that the puppies and kittens may scratch and bite, and keep your hands off so you minimize any scratches or bites. So it's all about the integrity of the skin, not letting an infection get in, a bacteria get in, which causes inflammation, and then it might cause swelling of the lymphatic system. And these same precautions we also have people who have a diagnosis of lymphedema even more strictly to follow, because when you have lymphedema swelling, that means there's protein is in the skin, and that's kind of like a really bad petri dish, that it's a lot easier for any infection to spread and become very serious in the body, serious enough that if you have a hot red rash and you have a lymphedema diagnosis, it may be cellulitis, so we send you to the emergency room so you can get the antibiotics to make sure that you're safe. So I've shared with you today some signs and symptoms that you might look for. I've shared where the lymphedema might occur in the body if you have a breast cancer diagnosis, if you've undergone treatment, and I've shared some risk factors that you can, kind of tips that you can use to lower your risk for getting lymphedema. And then I'll just reiterate, if you want any more information, if you would like to discuss this with someone in person, if you think you might have lymphedema, the way to get help is to contact your oncologist or your primary physician, and then have them refer you to a certified lymphedema therapist or the lymphedema clinic that's covered in your health insurance. So I hope that this kind of strengthens you and gives you more confidence to take these tips and then use them to lower your risk for getting lymphedema after a cancer diagnosis. Have a good day.